I will call into order our November 19th Benefits and Insurance Committee meeting. Madam Clerk, if you would please call the roll.
Preble Acton. Here. Rhonda Allen. Rhonda Allen. Dr. Andrea Anthony.
Here.
Doug Bodery. Doug Bodery. Amber Brown.
Here.
Shay Crowell.
Here.
Holly Deering. Holly
Here.
Deering. Thank you. Alan Farley.
Here.
Mary Hickerson.
Here.
Lois Miller. Lois Miller. Alan McAdoo. Jeff Phillips.
Present.
Shantae Sherrill. Eric Tutobeni.
Here.
We have a quorum.
Thank you, Madam Clerk. We do have a quorum to proceed with our business today. Before we get into approval of the minutes, I have an opening statement about our electronic meeting determination. This meeting of the Benefits Insurance Committee is being conducted electronically pursuant to Governor Bill Lee's Executive Order 16. I would like to ask for a motion that conducting the meeting electronically is necessary to protect the public health, safety, and welfare in light of the coronavirus. Is there a motion?
So moved, Mayor Ketron.
Have a motion from Commissioner Phillips. Is there a second?
Hey, Crowell will second that.
We have a second. Shay Crowell.
Preble Acton. Yes. Rhonda Allen.
Yes.
Dr. Andrea Anthony.
Yes.
Doug Bodery.
Yes.
Amber Brown.
Yes.
Shay Crowell.
Yes.
Holly Deering.
Yes.
Alan Farley.
Yes.
Mary Hickerson.
Yes.
Lois Miller. Alan McAdoo. Jeff Phillips.
Yes.
Shantae Sherrill. Eric Tutobeni.
Yes.
Motion passes. Next, we have on the agenda is approval of the minutes from the last meeting. Is there a motion?
Move to approve, Mr. Chairman.
Have a motion to approve the minutes from the last meeting. Is there a second?
I'll second that motion.
And that is who?
Mary Hickerson.
Mary Hickerson on the second. Any additions or deletions? Hearing or seeing none, call roll.
Preble Acton. Yes. Rhonda Allen.
Yes.
Dr. Andrea Anthony.
Yes.
Doug Bodery.
Yes.
Amber Brown.
Yes.
Shay Crowell.
Yes.
Holly Deering.
Yes.
Alan Farley.
Yes.
Mary Hickerson.
Yes.
Jeff Phillips.
Yes.
Shantae Sherrill. Eric Tutobeni.
Yes. Yes.
Okay, motion on approval of the minutes passes. Next, we have item number 2 on the agenda, financials. Mr. Elam, Director Elam, you're recognized.
Thank you, Chairman Ketron. On the 264 fund, looking for the month of September, for revenue we had $8,619,126. In expenses, we had $6,687,188. Our revenue minus expenses was, on the positive side, $1,931,938. For the month of October, we had $7,310,226. In revenue and expenditures, there was $6,680,115. And for that month, it was on the positive side of $630,101. Moving over to the totals in the calendar year, you will see that in revenue total is $67,813,671 compared to expenditures of $68,328,164. And revenue minus expenditures, we're on the negative side, $514,493. That's for the calendar year. For the fiscal year totals, you have on the revenue $19,506,718, and the expenditures total is $28,144,932. And you see that this on the negative side of $8,638,214. That's the 264 fund. In the 266 fund, you see on your graph that in September it was down a little bit compared to this time last year. And on your next page, your tracker, for the month of September, you will see there was $51,452.56 in claims. And the breakdown of that, the workers' comp was $3,790.35. OJI was $47,662.21. And compared to last year's claims, you had $66,661.46. Year to date in September, you have, for the year to date, is $155,586.32 for 2020, compared to 2019, $114,702.39. And that's for the month of September. For the month of October, you can see it was up a little bit compared to last year. Moving over to the tracker on the next page, you'll see for October, $51,316.04 compared to this time last year was $26,377.88. The breakdown for the October 20 is $2,096.96 for workers' comp. OJI was $49,219.08, and again that total was $51,316.04. Year-to-date total, to the left you will see the year-to-date is $206,902.36 compared to last year's $141,080.27. Mr. Chairman, that concludes my report.
Mr. Director Elam says that concludes his report. Are there questions on either one of the funds in his report, or any questions? Seeing or hearing none, Madam Clerk, if you would please call the roll.
Is
Ms.
there a
Thompson?
motion? Is there a motion?
I'm sorry. Yes, I do need. Probably you want to make that motion? Thank you, ma'am. I do have a motion. Is there a second?
I'll second that motion. This is Mary.
Mary Hickerson, seconded on the motion. Please call the roll, Madam Clerk.
Preble Acton. Rhonda Allen.
Yes.
Dr. Andrea Anthony.
Yes.
Doug Bodery,
Yes.
Amber Brown,
Yes.
Shay Crowell,
Yes.
Holly Deering,
Yes.
Alan Farley,
Yes.
Mary Hickerson,
Yes.
Jeff Phillips, Eric Tutobeni,
Yes.
Motion carries. Next, members, we have Workers' Comp, OJI, report from Mr. Good. Mr. Good, if you would please come forward. How are you? Good, sir. Good to see you today.
Good afternoon. I'd like to report in the month of September, we had a total of 15 injuries that required medical attention, bringing the year-to-date total at the end of September to 119. At that time, we have 83 that are OSHA recordable. As you look at the next page of your report, the 119 is compared to this same time last year to be 207, and the year before that is 199. The incurred dollars for the month of September was $112,000, bringing the total to $594, compared to $375 last year and $376 the prior year. On the last page of the September report, you'll see that of the 15 injuries, 7 of them were with the Board of Education, 8 were in the County General, and the 8 within the County General are broken down between the Sheriff, Paul's, and the Juvenile Detention Center. I'd also like to report for the month of October, we had a total of 18 injuries requiring medical attention, bringing the total for the year-to-date to 137, making the OSHA recordables a total of 98, of which 56 are restricted days, 23 lost time days, and 19 all others for the year. The 137 compares to this same time last year when we had 228 injuries, and the year prior to that, in 2018, was 227. In the month of October, we had $120,000 for incurred expenses, bringing the total to $713,000, compared to $415,000 last year, and the prior year to $526,000. On the last page of your October report, you'll see that the Board of Education had 8 of those injuries, and the County General had 10. The County General was broken down between the Sheriff Department, EMS, Juvenile Detention Center, the Correctional Work Center, Paul's, Solid Waste, and Finance. So it's pretty much all across the board for the county for those 10. That is all I have at this time.
Thank you, Mr. Good. Questions for Mr. Good? Dan, I've got a question. Are you saying are our injuries, are they just kind of everything across the board, or is there any common thread between, is it out of the 18, 9 of those are lifting? And if so, have you identified whatever those may be more in common that we might need to have some type of lifting class and
Actually, the injuries that we're having today have not been anything unusual than what they have in the previous years. It's in fact because of the things going on with the virus and things like that, we're actually much lower this year than what we have been as a total. But if you look into previous years, even though the month of September and October seem high, we're still lower than what we were in the same period the 2 previous years.
Yes, sir, but that didn't answer my question. You're just talking about the numbers. Have you identified anything that's common in those injuries that we might need to implement some type of instruction class, get people to learn how to lift properly, or are we just clumsy, or, you know?
The biggest things that we do have, the two biggest ones, are always going to be slip, trips, and falls, and strains. And strains comes from, this past few months have been people lifting things when the school system started back up and schools coming back in, getting the classrooms.
So are we working with the schools and having, getting them to check off that they watched the video, how to properly push with your legs and not bend over with your back, lift?
Yes, sir.
See what I'm saying?
I'm working with the county, the Board of Education Maintenance Department. They're working with me, what we've been doing on a weekly basis. I report to them every week as to what injuries have occurred and what's been happening over there with the Board of Ed, so that they can look at the environment to see if there's some changes that need to be done and corrected.
Yes, sir. And so you're making a report to them. Do we follow up to make sure that any corrective action has been taken, or just?
Yes, sir. Mike Walsh with the Board of Education and I have been working very close on all that.
Okay. All right, just inquiring. All right. Any other questions for Mr. Good at this point? All right, hearing none. That concludes your report, right, Mr.
Yes,
Good?
sir.
All right. Ms. Thompson, if you will please call the roll.
Is there a motion?
Is there a motion?
Thank you.
Move to approve the report, Mr. Chairman.
Mr. Phillips, Commissioner Phillips moves. Is there a second?
Second by Alan Farley.
Alan Farley on the second, and someone else? Okay. Please call the roll.
Preble Acton. Yes. Rhonda Allen.
Yes.
Dr. Andrea Anthony.
Yes.
Doug Bodery.
Yes.
Amber Brown.
Yes.
Shay Crowell.
Yes.
Holly Deering.
Yes.
Alan Farley.
Yes.
Mary Hickerson.
Yes.
Jeff Phillips.
Yes.
Eric Tutobeni.
Yes.
That's all, sir.
Motion passes. Next, we have our wellness update from Mr. Chapa, Signal Wellness Coordinator. Chuck?
Thank you, sir. Can you hear me?
Yes, sir.
All righty. So our wellness numbers for this year are continuing to trickle in, and a little bit of background to this. So historically, at this time of the year, we would have seen the final little stretch of individuals that went at the very last day or that time period. Those numbers would start to trickle in. And as you'll see as I start going through these, we are starting to see kind of a gap between last year versus this year as far as numbers and types of screenings and things completed. Currently, right now to date, for annual physicals, we're at 1,896 versus last year we would have been at about 2,039. Biometric screenings, we're about 2,069 versus 4,051. And again, at the tail end of September, is usually when we see that high volume of biometric screenings getting completed. Health assessments are currently at 562. We would have been at 2,917. Mammograms, we're actually up, and we've been able to partner with St. Thomas quite a bit, so we have more of those on file. So 1,007 right now versus 980 from last year. OBGYN screenings, 1,637 versus 1,649. Colon cancer screens at 360. Those are actually up from last year. Last year we were 337. Cervical cancer screens, 1,418 versus 1,401. Prostate exam screenings are at 449 versus 394. Flu shots are at 2,035 versus 2,320. And to date, completed individuals that would have met the requirement are at about 3,164 versus 5,124 from last year. I did want to say a couple things about some of the events and things that we've been able to accomplish lately. We've had a great partnership with the St. Thomas team, the new St. Thomas team at MedPoint, and I'll let them speak to some of the numbers and stuff like this, but we've been really successful at setting up some drive-through flu shot events for members of the county. We were able to set one up over at the Lane Ag Center on October 16th, and we saw, I believe, Amber can speak more to this, but around 150 individuals, families, and things driving through that. And then we also set up a second one at the Smyrna Town Center, or Town Hall, excuse me. And we saw a ballpark about 50 individuals come through there for that one. And so we're continuing to kind of work to set up some more of those type events into the future with the county as well. But that is currently my report, and I'll let St. Thomas speak a little bit more to those flu shot events.
Okay, thank you for that update, Chuck. Next, we have
Thank you.
MedPoint report. Today is Miss Amber O'Neill be giving that report. Miss O'Neill? Can't hear you.
Can you hear me now?
Gotcha. Yes, ma'am.
Okay, perfect. Thank you. If you don't mind, I'd like to share my screen with you so that you can see some of the data we've pulled together for you from the MedPoint Clinic.
Yes, ma'am.
Okay. So, we're going to go over some visit information that I have for you. So, in October, we saw we had 1,095 visits. Of that, 901 of them were unique members. A unique member means that it's one distinct person, regardless of how many visits or locations that they went to. It's one unique member in that. 453 of that was nurse visits. That accounts for those. Most of that is those flu shot scenarios that Chuck was referencing before. So we have had tremendous response to our 3 flu shot events that we've done recently. So if you see the numbers down below, you'll see that at New Salem in October, we had 652 visits. Stewart's Creek saw 177. Walter Hill saw 266 for that total of 1,095.
Yeah, I've got a question on that, Ms. O'Neill, and you may not have this information, but I'll ask Mr. Elam as well. This time last year, in our previous, the reason I'm asking this for October, and I know we weren't in COVID at that time, but what I'm looking for is a change of venue going from the portable at Blackman, which is now New Salem under Ascension. Are those numbers increased? We have any idea kind of where we were this time last year?
Yeah,
I'm sorry, I don't have the data from the previous clinic to do that.
But if we're seeing an uptick just because we changed and went to a newer, more professional building than what we had in that portable.
Right.
I don't know the exact numbers. I do know that we've had tremendous positive response from the patients themselves when they have come to the New Salem venue. Many of them just commenting over and over again on the difference between the Blackman Clinic and the New Salem Clinic.
Well,
so I think that's definitely having an impact.
Yes, ma'am. That sounds really good. Mr. Elam?
Yes. One thing I will point out is that when we're looking at the number of visits and stuff, it might be a little bit different than the way that Premise Health calculated the visit. But I understand what you're saying as far as, trying to compare the Blackman to New Salem. And the other thing is the walk-ins is moved to New Salem, so that wouldn't also be a fair comparison, because it used to be at Stewart's Creek and now it's at New Salem. But we can take a look at it and do a little bit more deeper dive into it. Just
the comments that Ms. O'Neill said that our patients continue to comment about what an improvement it is over our old clinic at Blackman Elementary, correct?
Yeah,
correct. Yeah, I had one patient who almost couldn't check in because she was so stunned by the difference that she couldn't seem to walk forward to the check-in desk. So definitely a positive response.
Good.
If we look by member type, you'll see that in October, 190 of our patients were children, 589 were employees, and 122 were spouses, for a total of 901. That is a little bit skewed, however, because of that flu shot event calendar as well, because if you look at the nurse visits below, of course, 453 of those accounted for were in those flu shot drive-throughs.
Yeah, that's still good. It's just one of those things when you change your venue and you want to know how long it takes your employees to find out and where your new location is, and even even the barriers that are in between, traffic. Highway 99 is still under construction down to one lane and back and forth on the bridge in front of, so it is just a tad bit further out, but it's glad to see, or at least hear, that people are talking more favorably about our new location. Okay.
Yes.
You can continue.
So in the visit type, 144 of your members had more than one visit in the month of October. One member had 9 visits, 2 members had 6 visits, 1 member had 5 visits, and then we had 144 members who had 2 to 4 visits, and then all of the rest only had single visits. I will comment that the ones who had a significant number of visits, the 9 visits, the 6 visits, and the 5 visits, in doing a little bit of research, we discovered that those were in some severe health scenarios. One of them was recently hospitalized for COVID and needed multiple follow-ups from that. The other one, actually all of the multiple visits at the higher levels were hospital follow-up visits that we were managing. Of those types of visits, 75 of them were annual visits, like preventative care exams. 305 of them would have been established patient visits, which could be anything from a medication refill to a cough, something along those lines. We saw 50 new patients. A new patient for us is considered to be someone who has not been seen at a MedPoint Health Center in the last 3 years based on that reporting from the patient themselves. So when they call in to schedule, they would tell us, we would ask them if they had been seen previously at the MedPoint clinics, and if so, how long it has been since they've been seen. And they don't get classified as a new patient unless they've exceeded that 3-year mark. 453 of those visits were nurse visits. The majority of those were for vaccinations, but some were also for things like laboratory services and whatnot. And then we had 24 telehealth visits and 185 virtual visits, which would have included audio and visual. Fridays were our busiest day of the week, but there were more Fridays than there were, say, Monday, Tuesdays, and Wednesdays, as there were 5 Thursdays, Fridays, and Saturdays in October. If you look, though, you'll see that our Saturday numbers are actually starting to climb, which we like seeing that the employees are starting to take advantage of those Saturday hours that are available to them at the New Salem Clinic to avoid having to go during their standard work hours, and it's working out very well. Of our in-person visits versus virtual appointments, so we have had our most virtual visits at Stewart's Creek and Walter Hill. This isn't particularly surprising, especially at Walter Hill. There's space and parking constraints there, so we're glad that the patients are taking advantage of the virtual options to make that more convenient for them. At New Salem, we had 598 inpatient in-office type of visits. Stewart's Creek had 105 and Walter Hill had 128, versus at New Salem, they had 57 virtual visits, 72 virtual visits at Stewart's Creek, and 44 at Walter Hill. But it's nice to see the patients taking advantage of those telehealth options for themselves, especially in the COVID environment. We had 84 referrals where we have referred to some sort of specialty care for the practices. Of that, New Salem referred 30, Stewart's Creek 34, and Walter Hill 20. You'll see that the majority of those referrals have been to the registered dietitian that we actually have here at the MedPoint Clinic. But in addition to the registered dietitian, we have referred mostly to gastroenterology, sleep medicine, OBGYN, and urology and otolaryngology. So in our PEPM report, you'll see that in September, we had 482 unique members, which worked out to a PEPM of 18. But in October, we had 901 unique members, so that was a huge uptick, which worked out to a PEPM of 30. So Our top 10 diagnosis codes and those things that we are trying to focus on here for these patients. Our top diagnosis is essential hypertension. The good part of that is, of course, it's still only 5.7% of our patients, so that's not terrible there. We're appreciating that. And then the second highest one is for an encounter for a general adult medical exam, which is those annual physicals. So that's good to see that as our second highest diagnosis there. Not surprising, as this is happening across the nation right now, our third highest is for anxiety disorders, and we're seeing a lot of that across the nation at the moment, but we're still only at just over 2.5%, which isn't doing too bad. And then type 2 diabetes, hyperlipidemia, and hypothyroidism kind of rounding off those top 5 there. It's in addition to that, which it wasn't really included in the totals of the diagnosis codes there, 40% of our diagnoses were for vaccines this month. So people are getting their vaccinations. We've seen a lot of flu, obviously, vaccinations come through, but we're also doing things like Tdap, and we've got some pneumonia vaccine and all of that. So it's good to see people getting their vaccinations.
Ms. O'Neill, going
Yes,
back to this past graph that you showed, top 10 diagnosis codes, what is the difference between other specified anxiety disorders, and then you drop on down, and then there's anxiety disorder unspecified?
There's a multitude of different types of anxiety that people could fall into, and so sometimes it's hard in a primary care environment to really nail that down as the specific type of anxiety that it may be. There's generalized anxiety, and there is situational anxiety, and all of those things. So it kind of encompasses both. Usually if it's other specified anxiety disorder, it means they have an idea of which type it may be, versus the unspecified, we may not yet have determined where at on that scale they may fall. So you may see that with a specified anxiety disorder, it may be something specific that we've already kind of identified as, here's a person perhaps having a grief reaction or something like that, versus the unspecified, we may not know yet what that driving force is.
Well, talking with our director of EMS, Director Hudgens, he has shared with us, and I think you're seeing it on TV as well, nationwide, because of COVID, because of quarantining, we're seeing an uptick in mental issues.
Was that last thing?
Drug overdose and suicides are on the upswing because of COVID related. I didn't know if this was we're seeing any of that or not.
Definitely it is on the upswing nationwide. I mean, that's what we're seeing. People are feeling very isolated, and that affects people's mental health. And then there's just fear about the environment, and that affects people's mental health as well. Unfortunately, without having years worth of data to see what the percentage may have been of anxiety disorders within this particular population, it's hard to tell if that's the increase for these patients or not. As we go through the next few months and we see those numbers and we see if they go up or down, then certainly we could see if there's trending.
Yeah, I'd like for us to keep an eye on that, see if there is anything trending as we continue under these unusual times, if we could.
Yes.
All right, thank you.
Agreed. Yeah, we're definitely looking at that.
Okay.
In October, the majority of members that we saw were female. And so we saw 0.26% of the patients we saw were female. And in the range of 42 to 51, both female and male were the highest population seen. So that age range of 42 to 51 seems to be the highest seeking care, as well as women being the ones who are coming in a little more common for the month of October.
Oh, I'm behind me, but I'm not.
We also have been kind of keeping an eye on BMI because it does affect so many health conditions. So for October, our female population, who also was the highest seen, also had the highest percent of BMI, and it was in that 40 plus range, which is that class 3, not where we would really hope that they would be. And then our male member population, their highest percent of BMI was in the 25 to 29.9 range. But this also kind of accounts for why we had so many dietitian referrals. You know, we're trying to look at that and help with these scenarios. We have not added this quality scorecard summary yet because we have not made decisions as a group on what will be tracked, and we also don't have enough data, only being 2 months in yet, to really kind of add to that. But going forward, we will be having a section in here talking about plans for quality care and what those are going to look like going forward. That's the last of what I have for you all today. If there's any questions I can answer for you, I'd be more than happy to.
Okay.
Mr. Chairman,
Questions?
this is Commissioner Allen. I have a question.
Commissioner Allen.
As we go back and try to track the trending on the anxiety, is there any way that you all can you identify if we're seeing clusters within departments, so that as an employer we could potentially do some training or something? I don't want you to violate HIPAA or anything like that, but I didn't know if you have any way to track back to see if there are clusters within departments. Is it in education? Is it in law enforcement? Is there a place where that resides more heavily than another?
You know what? One of the people from our data team is actually on this call today. Let me see if she can come on and answer that, because I don't know if that's a trackable field. So let's see if Karen can answer that. Karen, can you attest to that?
Sure. Thank you for that that insight. The data that we're currently pulling from is our EMR, and I will definitely talk with Ed and Jane to see if there's a way, when they're providing us the eligibility list, they can also provide us maybe department information, and we could butt that information up when preparing the data. But that's definitely good information, and I'm taking notes on being able, moving forward, to trend and show you guys based on behavioral health and other diagnoses based on disease category. But I will bring that up to Ed and Jane with Rutherford County to definitely see how we can track those departments.
Excellent. Thank you.
Thank you.
Is there any other questions I can answer for someone, or Karen while she's here for the data side of that?
Anybody have any other questions for Ms. O'Neill?
Catherine, if I could just make a comment here.
Yes, sir.
St. Thomas and our department have worked pretty hard trying to put this report together, trying to get some insight into, as committee members, what you would like to see. And what I would like to suggest that I'd like Commissioner Allen's comment and Chairman Ketron's comment, and we'll see. We want this report to be what you want. So if any of y'all, after you've looked through it and you see it and you think that you'd like to, that you don't need that information, or you want some more information and we're able to obtain it for you, if you would send me an email, I'd be happy to see what we're able to do based on where we're pulling this data out, and see if it's obtainable. So anytime, once you've reviewed it, just shoot me an email if you have any suggestions. I'd be happy.
Thank you. Good comment.
And if I could mention one other thing, they talked about the flu, drive-through flu. We did one at the New Salem location, they did one at Ag Center, and they did one in Smyrna. And there was 3 of them, and I think the numbers were somewhere close to 400 and something, somewhere in there, plus or minus. But one of the things that was pointed out, and I can't take credit for it, I have to give St. Thomas credit for it, but in the drive-through, we had several parents come through with kids with special needs, how thankful they were that we actually did it. And so I think that was another thing that was a big success. And, it's something that we will look at next year again, trying to implement.
Sure. Good, thank you. Any other comments or questions? Seeing none, thank you, Ms. O'Neill. Next, we have our last item is other business, our annual enrollment numbers. Director Elam.
First of all, I'd like to thank my department for the hard work that they did, and we were faced with quite a bit of challenges. We had a plan laid out last year, and this year was absolutely totally different. We did everything that we could. They worked very hard, and main number as far as participation, what I will tell you, in 2018 it was a passive enrollment, and there was 51.54% went into and accessed the ADP. In 2019 it was again a passive, and it was 51.27%. In 2020 it was again a passive, and it was I'm sorry, that was 2019. 2019 was 68.99%, and this year's for 2021 that they went into in 2020, I'm sorry, was 72.77%. So compared to last year, we had over 300 people, more people that went in to the benefit system. We had almost a 4% increase. And we didn't have the face-to-face, anything like we did last year. I mean, it was just emails. It was a lot of phone conversations. It was a lot of stuff done electronically. And I'm really, I want to say, the members that are on the plan were just so gracious and so nice. And we're just very thankful for everybody's attitude, because I think, as you said, Mayor Ketron, with COVID and stuff, people are a little more anxious, but we just had a wonderful interaction with our members and our employees during the annual enrollment.
Well, thank you, Director Elam. I want to say thank you to you and your department, all your employees. I know they worked extra hard. I know I could tell a little stress in your voice at times over the last several months as all this was coming together, because it was a big lift for you and the employees in that department. So our hats off to a successful enrollment. And all the county employees, I'm sure, are appreciative of that. And thank you for the good work that our risk management and insurance department is doing. Thank you. Any other comments to come before us today? Is there a motion to adjourn?
Motion to adjourn.
Motion to adjourn by Mary. Is there a second? Ms. Acton, second. We're adjourned.